I'm with Dr. Paul Carpentier, and we're at the National Press Club talking about the pill kills. I remember the first time I was talking to my wife about this, and the first time I found out about the pill and its dangers, not only to women. That was something I kind of knew by reading it on the box, but the first time I found out it was an abortifacient, it stunned me, and I showed my wife, and she looked at me in horror and said, "You're never going to get women to believe that." And it has been an uphill battle for years trying to convince people of the dangers, not only to women and children in the womb, but also to women who are taking the pill. It is significant, isn't it?
Absolutely. I mean, the dangers to the embryo you mentioned. The pill is such a strong, artificial, hormone-like drug that it's speaking to receptors all through the body. And that's why it was created that way, to interact with a woman's receptors. So receptors for estrogen, receptors for progesterone. Well, what supports the lining of the uterus is progesterone. If you're interacting with those receptors and trying to block the effects of progesterone, then the lining of the uterus stays very thin. So if there's a new life on board, it's almost like strangling the oxygen from that new life. As far as women's other health risks, there are receptors all over our body. We've spent a lot of time today talking about the chance of blood clots. There are receptors within these substances in our body that promote clotting. And so that's why American Airlines cautions us that flying when you're on the birth control pill is a risk. The brain has estrogen and progesterone receptors. So that's why we see many women that are on the birth control pill have migraine headaches, have depression, decreased libido, just an ill effect, sometimes not sleeping well. So a variety of things. Now, I don't prescribe the pill, so I don't see a lot of these in my own practice. I've been in practice for 20 years in family practice, and but I'm covering colleagues and doing rounds at the hospital, and we're seeing the effects of these portrayed in women.
So you see the women who are having complications due to the pill and recognizing that there's a connection there.
Certainly. I mean, that's well documented. It's in the periodicals that describe how the pill works, and it's in the package inserts for the birth control pill. There's no surprise about that.
And I think that that's one of the difficult things, though, is people, they hear about it, but they think it won't happen to me. And I think that's often the circumstance. I mean, obviously millions of women are taking the pill, and they're obviously taking that chance of it won't happen to me. Is this kind of like, if I were to throw an odd comparison out there, is this kind of like having a bundle of wires and perhaps snipping one of them, or short-circuiting it? I mean, because like you said, we're doing something chemically and altering our body, aren't we?
That's right. That's how it works. That's how it's intended, to alter how the body functions. And many doctors are trying to make use of that for very simple things such as ovarian cysts. So you have an ovarian cyst, here, let's put you on the birth control pill. Hopefully that will take it away. If you have irregular cycles, here's the birth control pill. Now your cycles will be regular. Well, they're not even true cycles. You've basically shut off the body so that she's not having her own cycles, and you're giving her a shedding of the lining of the menses, the menstrual lining, and so she says, oh, I'm having my menstrual cycle. Well, it's not really a cycle. It's the drugs that are doing that to the lining of your uterus. So these trivial reasons that people are given, even acne these days is a reason to give somebody the pill. But as we've tried to point out this morning, it's such a powerful drug and a dangerous drug to treat acne for that. If you wanted to have any hormonal influence that, try to impact the hormone's influence on acne, is like, well, figure out the physiology of how the acne glands respond to the hormone of the pill instead of shutting off the menstrual cycle.
Well, I think these dangers that you're talking about are so significant, and I know you say that they're well documented, but I don't think people really know, and I think that it's something that's not discussed enough, and especially in our schools, sex education is discussed, not problems with the pills and condoms and everything else. Do you know of any effort where it's trying to counter that, and maybe actual education on these things is being brought to the schools?
Well, I've been thinking about this, preparing for this press conference, and we fault the doctors for not describing it to the patients as they're giving them the pill, but maybe it's more the fault of doctors that understand the dangers of the pill, and they've been silent over these years. And I've tried to influence the school committees, and they let me attend for a couple meetings, and then they say, okay, let's have another meeting, and don't let Dr. Carpentier know we're having another meeting, or there's just so many things in the media. We could talk about how the media, where's investigative reporting? There's something that, as Dr. Kerr pointed out this morning, is killing so many women and influencing 7 of the 10 greatest death risks for women. It's influencing that in a positive direction towards more deaths and more risk. 7 out of 10. Where's investigative reporting?
Well, that's a really good point. And for those of you watching this, obviously, it's not like you turn on the TV anytime and see any report about this. It's not like there's articles written all over the place about this. But the information is there. We just have to find it. Do you know where people can find more information about this?
Well, the site that comes to my mind is One More Soul. One More Soul is a site that gathers all kinds of tools and resources, whether it's an audio tape or a DVD or a book that you'd like to read on these topics. You can find that there at One More Soul, which is sort of shortened on their website, www.omsoul.com. And you'll also find links there to other places, such as the Pope Paul VI Institute, where they developed NAPRO technology, which is the flip side of this, 180 degrees. It's healing the underlying problems in a woman's body instead of suppressing it with the birth control pill. And in the process of suppressing it, you're subjecting the woman to all of these risks. In the process of healing it, you're decreasing her risks in the future. Risk for breast cancer, endometrial cancer, depression, loss of libido, blood clots, and so on. You're decreasing the chance of that. You're helping her body function better.
Well, I guess to wrap it up, we talk about the woman, and of course we're talking about the pill kills the woman. What about the man in this? Shouldn't the man care about his wife, about his girlfriend? Men typically, a lot of them don't want to have the child, so they look at the birth control pill as a solution. But is it really? And how should the man think about the pill?
That's a great question, and that's probably the subject of future conferences, because it is so important. If you interview men, and it's been done in 2 different studies, one in Missouri and one in Utah, and you talk about the principles involved in natural family planning, they all know about the birth control pill, and maybe not in a depth that we would like them to know, but they know how it works, that suppresses the woman's system. But if you tell them what natural family planning involves, if you ask them, are you interested in something that would require a week of abstinence every cycle, you'd think that they would say no. Most people would say, oh no, the men aren't going to be interested in that. 87% of them are interested in it.
Wow.
They're interested, as you say, in protecting my wife from these things. Why should she need to do that for our future planning and perspective of how our family should play out? Why should she put herself at risk? I'm her husband. I should not put my wife at risk.
I agree. Well, thank you, Dr. Carpentier. Appreciate you taking the time to speak with us. And for you folks out there watching this, obviously it's something that you should research. For you women, don't just pop the pills and think that everything's going to be okay. For you guys, research it and find out what your girlfriends and your wives are getting involved in. These are important issues that affect us health-wise. A lot of people are injured and killed by the pill. We need to do all we can to understand more about this. Thanks again.
Thank you.